Welcome back. Well, imagine having to get medical attention in a language that you're not comfortable with, or maybe you're still learning. That is the reality for many people living here in the Bay Area. And tonight, ABC Action News in-depth reporter Anthony Hill taking a closer look at the current difficulties and the rights that patients have for language services at hospitals that receive government funding.
The population of our country is growing every day. There are more than 330 million people that call the United States home. But with the increase in population, there's also an increase in the number of languages spoken. And Florida is one of the top states that has large populations of people that don't speak English as a first language. And as it turns out, hospitals are being tasked with providing equitable medical services for people who speak other languages. But some say not all hospitals are keeping up with the pace of demand.
It makes things a little bit more complicated for her.
But it's definitely something that hospitals need to step up and address. It's a great opportunity for them, especially now as we see the recent census data coming out showing the massive increase in diversity in the U.S. population.
According to a census survey, about 30% of Floridians are speakers of a non-English language. That's higher than the national average, which is 22%. This is Tu Junk getting an ultrasound. Tu is from Vietnam, and she's been living in the United States for 3 years. Still learning English, she's thankful to be able to receive medical attention in a language she knows and understands. Tan Xuan Lee is Tu's midwife and has been seeing her since her first trimester. Lee tells me she met Tu just like how she meets the majority of her Vietnamese patients.
She was referred to me by her primary care provider.
Lee will be translating for Tu in this report. Tu says the process of having a doctor's appointment can be difficult for her and her family.
She would have to get like friends or family or her younger sister who speak English a little bit better, but with their work and school, they have to take off to take her. So it's inconvenient for her to have to use family or friends as translator.
The 1964 Civil Rights Act requires hospitals that receive federal funding to provide language services to patients that need them.
While hospitals are obligated by law to provide language services if they receive federal dollars, i.e. Medicaid and Medicare dollars, reimbursement, the onus is on the patient to demand them.
Dr. Melody Schifino is a professor at San Diego State University and has extensively studied the access to health care for those who don't speak English as a first language. She says hospitals that don't provide language services place a burden on the ones that do, because patients who are non-English speakers end up having to go to the same hospitals. In addition, many of those hospitals that cater to non-English speakers may not be close to where the patient lives, creating inequities on who has access to decent medical services. And she says hospitals lacking language services end up being a lose-lose situation for both the hospital and the patient.
If I can't understand what you need, I'm going to do more diagnostic tests, right? So they're going to be more invasive probably, because I really want to get to the bottom of what's wrong with you, and you're not able to tell me. So they add up, the costs add up. So that also costs the hospital more money, and that's not going to be very pleasant for the patient.
As for the Vietnamese family that's expecting a new baby, well, the husband is just happy to know, without any uncertainty due to language barriers, that their baby is doing just fine.
For her husband here, he feels the peace of mind knowing that the provider can explain to him more about her health and the baby's health.
Now, I wanted to find out for myself just how difficult it would be to arrange for language services in the Bay Area. So I called hospitals all over the Bay Area, from Polk County to Sarasota, even in Pinellas County. And at least from the people I spoke with, I can say that it was pretty difficult to get that information. But Lee, the midwife, did tell me that both USF and Tampa General do provide language services. You do have to call in advance, though, to arrange that. In Tampa, I'm in-depth reporter Anthony Hill, ABC Action News.